Well, we hear about so many workforce shortages, and we've got a really difficult one to talk about today. Joining us, Mary Steele, the Director of Compliance and Oversight with the Area Agency on Aging 3. And thanks for joining us, Mary.
Thanks for having me, Holly.
Okay, so you have a direct care workforce shortage. So tell us about this, because this just seems like so terrible, especially if you're a family in need.
Absolutely. So our agency administers several programs which individuals can qualify to receive help with their what we call activities of daily living, their personal care, their homemaking activities in their home, and many of the local home health agencies are struggling to find applicants that wish to work in this field. We saw the shortage initially begin back in 2019 before COVID hit. Since then, we've seen it affect 7 of our providers in our 7-county area to the effect that they've either gone out of business or needed to withdraw from working with our programs. Unfortunately, the reimbursement rates that the state sets for these services just is not keeping up with the current cost of doing business, and with people wanting to work in that field, since it does take truly a special kind of person to be able to want to go in and work one-on-one with folks in need with those most personal needs.
Right, yeah, and I mean, the seniors, they want to stay in their home, and so this person is so important for them to be able to, daily live and stay in their home, aren't they?
Yes. So back in 2019, when we saw this begin, we had about 20 folks that we were seeking providers for, and now between the 3 programs that we operate, we have 350 individuals that are not receiving personal care. We're able to do other services for them to help them, and they have family. Some are able to get short-term services through Medicare or Medicaid, but yeah, I mean, to see it hit this many people in our region it's devastating.
Yeah.
So we held a roundtable discussion a couple of weeks ago, and we had a really good response. We had some local legislators attend. We had representatives from the state Department of Medicaid, Department of Aging, and so we were really able to let them know how this is affecting our area. We work with the Ohio Association of Area Agencies on Aging, and they are strong advocates at the state level for all of the organizations throughout the state. And so they have proposed some possible tools to try to help with this issue. They are, proposing rate increases to the state, and seeing that with those increases, some of that money is earmarked to go towards salary versus potential administrative costs. They're also proposing some other services to change a little bit with the homemaking. We're looking at adding a provider engagement coach through our agency to try to get out there and spread the word and see if we can recruit additional providers.
Right, yeah, so if there is a person that would like to be able to, help someone in the home, what kind of training do they need? What do they have to go through that maybe, try to help you out? As you mentioned, state level, you're getting them maybe a little help. What else can we do?
So if an individual is interested in doing this type of work, we would like to steer them towards the local companies that we work with. There's training that is provided through their office by a registered nurse or an LPN. There are some background check requirements, those types of things. Also, if folks who are already connected with our agency through the Passport program or the Ohio Home Care program, they can talk with their care manager if they have a friend or family member that would like to provide that service and get certified to become an independent Medicaid provider and do that service for them.
Wow, I mean, did you ever think that it would get this bad? I mean, like you said, you realized something was going on in 2019, but this just seems like, wow, it's blown up so quickly.
Yes, and you know, we all drive down the main roads and we see help wanted signs all over, but to really think that it would affect, you know, services that you know, are vital to folks staying in their own home and being able to remain independent, I would have never thought that it would extend to that degree.
Wow, what efforts you guys are making. It's great to know that you're trying, and if people can help out, hopefully they'll step up. So thank you, Mary, for joining us today.
Thank you very much.
All right, don't go away. Noon Edition continues in a moment.